And you know now, Your Excellency, first of all, I'm very touched today. And I want to congratulate everybody that put the money to good use. This is the kind of Kenya we want, where you're given a budget and you do the right thing. Now that I have your audience, and I know you're a very busy man, Your Excellency, we have a problem at Kenyatta National Hospital. They are detaining patients. There are a lot of patients being detained, beds being occupied by people who should go home. And us as politicians, we are actually crippling Kenyatta National Hospital, because over the last 10 years, they've probably written 10 billion shillings. And when they get a budget, they're not being given the 10 billion that they've written off. So they need to be replenished with their budget so that they can be able, because if you're given a budget for the year and you wrote off last year, because your patients couldn't pay, then obviously you're sinking in a big hole. So Kenyatta National Hospital is challenged. I don't want any of those patients to spend Christmas in the hospital. Some are detained for even 6 months, 1 year. I really pray that you will give a directive to release all those detained patients, because that is part of your UHC.
We have also ring-fenced resources for every facility so that it is not used for other things. It is used to make sure that the delivery of service in every facility is much more efficient, is better, is improved, and we will get the public to work around it as we build a healthcare system that leaves nobody behind. It will also eliminate the current problems we have, including the ones Esther was talking about. In hospitals where people go in car bills, and nobody knows who is supposed to pay because they don't have the ability to. Going forward, every citizen of Kenya will have a health card. Every citizen. So going forward, there will be nobody who will be detained in any hospital, because we have made provision for every category of treatment at the primary level, at the referral level, and referral goes all the way up to the chronic, the emergencies. We've thought out the whole process so that nobody gets detained again, as is happening at the moment in any hospital, because we will have made the right decisions. And it is my intention to make sure that we sort out this challenge that has been with us for many years. And this time round, I think we have it in the right place. And I want to thank again Parliament. They passed all the laws in record time. We now have a framework. I'm going to be forwarding to Parliament the regulations in another month or so to make sure that we have the complete policy and legislative ecosystem to make sure that we deliver on this matter of health. Meanwhile, I will look at what to do so that nobody spends Christmas in hospital.